Dear visitors, dear exhibitors, please welcome with me together Ilya Reznik from Israel with his lecture about the usage of cannabis in neurology and psychology. Thank you so much for coming here. It's a really great honor to speak today. Thank you.
Good afternoon, ladies and gentlemen. I hope that you have enough patience and energy to listen to my talk. First, I would like to express my gratitude to our hosts, CULTIVA organization, that organized this event, and to say that it is great to see how many people would like to know more about cannabis and its properties. This is first time I'm here, and I'm grateful for my invitation to be with you this day. I suppose that such kind of events should be performed more frequently, and I know that you have some options to visit such events in Europe, such as CULTIVA, Cannabis, Cannabis. So all these events now have a professional program like Congress here, and this is the best opportunity to be involved in the recent achievements in the field of medicinal cannabis and cannabis use. So I would like to invite you to participate in these events. First of all, I would like you to, being first time here, I would like to introduce myself and saying how conventional psychiatrist and neurologist had his way from conventional biological psychiatry to cannabinoid medicine. Believe me, this is a long way, and I made it within last 7 years. It was not easy, and I would like to share my experience because I am only an Israeli physician here to say how it was difficult for me to transfer my major activity from the biological psychiatry to cannabinoid medicine. It was not an easy way to do it. I was graduated 25 years ago and fully educated as a conventional psychiatrist and psychopharmacologist. I made my career in the research and clinical activity. Well, I studied a lot many psychiatric disorders. Most of all, I worked in the field of post-traumatic stress disorder. I was the head of our clinical research unit and post-traumatic stress disorder unit in our hospital, and I worked with my post-traumatic stress disorder patients. They were first patients, I met them, and I was informed by them that they use cannabis as a self-treatment. When I met them and I was careful enough and patient enough to listen to my patients, it helped me to understand them better and to understand that the usage of cannabis is an attempt to alleviate their symptoms and to bring them to the better quality of life. I believe I just began to listen to my patients and fully aware that my patients are not substance abusers and not narcomans at all. They're just patients that need to be helped, and they found their medicine, and they were the same people who brought me from biological psychiatry, strongly oriented, to cannabinoid medicine. It was not an easy way, but I just learned how to listen to our patients. And now in my majority of my activity belong to cannabinoid medicine. I participate in several clinical trials in Israel and international trials in field of neuropsychiatry and neurology, psychotic disorders, post-traumatic stress disorder. I suppose this is a very intriguing and most interesting field of medical science, clinical medical science that's developing now, at this moment in the world. I would like to introduce shortly my presentation. I will bring you my greetings, and we'll try to describe shortly some points on basic neurology, basic clinical pharmacology of cannabinoids, some information you already had from previous speakers. Unfortunately, I'm speaking after such good presenters like Professor Hanush and Paul Hornby that fully informed you about many properties of cannabinoids. So I would like to introduce you shortly in this field. And I would like to divide my presentation to two topics. First, I will deliver today a talk about general aspects, and tomorrow I invite you to come to my lecture. I will speak more about particular disorders such as Alzheimer, Parkinson's disease, schizophrenia, etc. I would like to say that I had any kind of potential conflict of interest. I'm a private physician in Israel, and I'm working only for my patients, the only source of my income. I believe that being fully independent allows me to be really devoted to my patients as a full-time worker. My greetings to you from the Holy Land, because as you know, in this biblical land, we used cannabis for thousands of years. Thousands of years it was used mostly for rituals and spiritual purposes by the priests. Now, the majority of the users in my country use it for recreational purposes. As you know, this is the most widespread use of cannabis, is for recreational purposes, not for rituals, but also we had our long way history from the biblical land till now, when we have one of the best programs for medicinal cannabis in Israel, and I would like you to share tomorrow our experience about this. My greetings to you from the Holy Land. What about marijuana and cannabis? You know that cannabis could be produced from the flowers. You had a lot of information from Professor Hanush, how it was produced. The way how we can have cannabis, one of the most widespread is hashish. Is a proceeding of the plant, is a resin. So we have hashish of many properties. In Israel, unfortunately, we have hashish of very bad quality. Hashish is smuggled from Jordan, from Egypt, and possess many toxic instances. Unfortunately, in Israel we have hashish very low quality because of the poisoning and toxic elements, so we could not rely on it. This is what was one of the major tasks for us to change hashish smuggled from different countries to Israel to our produced legal cannabis for medical patients that will allow to use it under the special permits of Ministry of Health. We needed to provide our patients good quality cannabis with checked contents for cannabinoids and toxic agents for sustainable prices. So we achieved majority of this task we achieved in Israel, and Professor Hanush told you about current system in Israel, and I wish you to have such programs in your countries. Maybe you will like to know more, because I'm one of the inventors of this program that has many bad points, but also we have one of the best programs in the world. So if you would like to ask me later, I would like to answer your questions. So about hashish in Israel, we have a very bad quality of hashish, and I would not advise my medical patients to use hashish because it could not be reliably checked for toxic substances. Many other preparations like hash oil, we use them frequently, but the quality and the concentration of THC contained in each of them are vary from each of suppliers. We have various suppliers. Professor Hanush told you that we have many suppliers. Each of them possess their own strains, and sometimes patients have big difficulties to find the particular strain and quality of hash oil that fits them exactly. What are active agents? You know, we already told you about delta-9 THC, delta-8 THC as the most stable agent, cannabidiol, and other active metabolites. Also, we suppose that terpenes have the entourage effect and maybe psychoactive effect. Now, these issues are under investigation. About active, as a most active cannabinoids, we should say about THC and cannabidiol, because they should be studied initially for each cannabis patch. Without knowing exactly CBD THC ratio as a major knowledge we should have for each, we could not advise our patients how to use it wisely. We physicians have our full medical legal responsibility for the health and for the safety of our patients. First, primum non nocere. First, we should not harm. We should know exact ratio of cannabinoids in each plant that deliver for my patients under medical cannabis license. Without this information, we could not prescribe. It is one of the main obstacles because many of our growers do not deliver it correctly. About pharmacokinetics, you know that most efficient way to deliver cannabis to somebody, this is inhalation. Inhalation could be through direct smoking or through vaporizing. We suppose that vaporizing is a most efficient way and less harmful way to deliver cannabinoids to each particular patient. Also, we could use suppository as a very efficient way, making such suppositories under good quality control together with chemistry. We should know the concentration of THC and different cannabinoids in oil, and we could make suppositorium that could be delivered to patients. Patients could use it per rectum, and women could use it per vaginal. It's also a very good way of delivery because of full absorption being made there. So we advise this way as a less harmful and most efficient way to deliver cannabinoids. Other ways, edibles, tinctures, and teas are not so reliable because of different way of metabolism in each patient. So they going through liver metabolism, and we suppose that it's changing, varies from different patients. Also, for the last 5 years, we have a very good medications. We call them Sativex. It is a official formula from GW, the company that developed this first cannabinoids, natural cannabinoids medication, came from plant, not synthesized like MaReNa. MaReNa, you know, this is a THC synthesized in laboratory and delivered to the patient for vomiting and nausea due to cancer therapy. And the Sativex is delivered for patients suffering from multiple sclerosis. Also, I use Sativex in my clinic for different neuropsychiatric disorders such as Tourette disorder and Parkinson disease. It is very interesting medication. It is not effective for each patient like many other medications. So about distribution, you know that cannabinoids are lipophilic and they cross blood-brain barrier, so we should be aware about these properties and know the way where my patients using this. I ask them frequently, what kind of you prefer to use your cannabinoids? And according to their preference, I try to prescribe them or to recommend them how to have a fine-tuning in their treatment. So first, we as clinicians should listen carefully our patients and try to find the way of cannabinoid treatment that fit them. Many of my patients are suffering from post-trauma due to Holocaust. They were Holocaust survivors, and they will never use it as a direct smoking. Even in concentration camps, they did not smoke, so they prefer to use it as a tinctures, as a edibles. So I prescribe to my elderly patients, all of them are very old, I prescribe them to use cannabinoids only with as edibles and as a oil. About metabolism, the cannabinoid, in the majority of the patients, the metabolism is very slow. But also we have a large various differences between the patients in the level of metabolism. So this is why it is very important to know how quickly patients metabolize cannabinoids. It's various from patient to patient. I should ask them carefully, please say me when you are feeling first initial reaction to cannabinoids and when you're feeling that they are passed away. So this is what declare how often they should be prescribed, 3 times a day, 2 times a day. Sometimes it is enough 2 times a day, and sometimes it is 4 times a day. It's suitable for them without side effects. About the mechanism of action, you know from the lecture of Professor Hanush that we now currently investigating this very, very intensively in many various laboratories, even in your country, in Austria. We have several good laboratories investigating the mechanism of action. Final mechanism is unknown till now. We could not indicate directly what exact mechanism of action on the molecular level. We know many ways. Some of them are our hypotheses, and we try to investigate it more. Recent years, we concentrated our research efforts on the endocannabinoid system, and you had a great review of this system made by Professor Hanush. You also heard about 2 kinds of receptors. We use this knowledge in order to educate our patients, because they come to my clinic and ask me, doctor, explain me why it's not functioning for me like it's functioning for my neighbor. I should explain them that the dispenser of cannabinoid system is very different from patient to patient, from one individual to another. So they should not expect to have the same result like their friend or their relative have, even for the same strain, for the same batch. You know, you already had information about THC receptor, CBD receptors concentration. This slide displays you what exactly the areas we expect them to be under function of THC. So we should understand that because of majority of CBD of CB1 receptors concentrated on the cortex, first effects will be behavioral. So cortex is a part of the brain who is responsible for our behavior, and behavioral changes are first effects of cannabis could be found. Also, you already had such slide or something very similar, saying you that that also the other area very efficient for cannabinoids is hippocampal area. All functioning concerning for memory, etc., are very affected by the cannabinoids. You know that the binding of different receptors is a major point, and we're investigating it now. This slide displays you how THC is going to be binded to THC receptors, to CB1 receptors in different parts of the brain. And as I told you now, we should expect what dose should be prescribed to our patients. First, we are saying, go slowly, begin from low doses and go slowly. what kind of effect we could expect from our patients. First of all, it could be the level of self-control could be vary. And my patients saying me, now under the cannabis, I'm more tolerant to the noise, to children noise. Many post-traumatic stress disorder patients are have very low threshold for any kind of irritations. So even low doses of cannabis permit them to gain better self-control, but sometimes self-control are losing, so we should be very careful to this area. Majority of patients describe relaxation, drowsiness, euphoria. For some extent, for my depressive patients to be euphoric, this is a very desirable measure. I do not consider it's a side effect. I would like them to be euphoric because for depressive patient, this is a major achievement. We do not have in our biological psychiatry no medicine to improve the mood of these patients. Sometimes we could reduce some depressive symptoms, but we do not have any medicine in conventional therapy, in conventional psychiatry that could increase the mood of the patients. Only cannabis allows us to do it. So I use it for post-traumatic stress disorder, and I will describe you tomorrow what the effects are in my category of patients. So we have also short-term memory impairment, and sometimes the feeling of the time is changing. I don't see it as a bad. Sometimes it's a good, because post-traumatic stress disorder patients are very irritable, and for them to giving them a sense of time that is longer, that is now, is giving them more pleasurable feelings than they are feeling because of the disorder. Also, we should put into consideration some impairment in fine performance, for example, and in driving. I would like my patients not to drive under the acute effect of cannabis, but I do not close for them the driving license. I just ask them to be in full control for themselves, for their own security, and security other participants of the traffic, because we could not control all our patients all time. I believe that they do not harm anybody else, and they do not want to endanger their own life. I just ask them to be responsible and to have full responsibility for their behavior. I suppose that driving under the cannabis could be done, but very carefully. Everybody should know his own level, his own dosage, and it could be done. Our institute in Israel, our Institute of Safety on the Roads, permits driving under the cannabis until this person has a full level of self-control. I would like to say you that in Israel now we have a large sample of cannabis-treated patients, more than 20,000 current patients. And when I asked our chairman of Institute of Safety on Roads how many incidents involving such patients you have as last year, we have only one such incident. Is much lower than it could be just by chance because of statistics. So we are saying about most efficient and most safe method of treatment, but we should educate our patients how to use it wisely for their own security. About the dosage, in high doses, cannabis could produce some desirable and some undesirable effect. Sometimes it could cause paranoia feeling, agitation, confusion. Our patients should be informed about these effects from the very beginning. I have two different sources of the patients. First source of the patients, they are patients who already know about cannabis. They already tasted, they already used it. They came to me saying, "Doctor, I use it for several years as a self-treatment." So I work with these patients as knowledgeable patients, knowledgeable people that already know side effects, possible side effects. They know the dosages, they know even the strains, what are strains desirable for them. Other category of patients, there are patients that are coming to me just because they would like to be treated with cannabis and would like to ask more about it and never used it. For them, it is very difficult strategy to go from the low doses and try to find a proper strain for them because they are very, very sensible for side effects. We work with them carefully and try to educate them and their family members. This is a very, very difficult work, and I rely in this work on our patients associations, our instructors that are coming from their own illness, and they could instruct patients and the family how to begin treatment with cannabis in order to avoid undesirable effects. What kind of physiological effects of marijuana? You know, it could increase blood pressure and pulse rate, also cause redness of eyes and other effects. Sometimes effects are very desirable, such as munches due to appetite increasing. But for some people with bulimia nervosa, with some eating behavior, we should control for this because it could initiate another episode of bulimia. So for such patients, I suggest to use a CBD and not THC because THC increasing the appetite, and CBD sometimes even reduce it. For obese people, we suggest to use more CBD because of its properties. So we should wisely trying to find for each patient his own cannabinoids, his own strain with these properties. What other side effects of marijuana could be described? You know that it crosses the placental barrier and could affect mother and his child on the very early ages of development. In generally, cannabis is very safe medicine. However, when we are treating women in childbearing ages, they should be worried, should be warned to use it as the lowest possible dosages for their own safety. However, for my patients with epilepsy, we could not avoid it. Even in the early stages of pregnancy, we prescribe them high CBD content because due to risk of seizures of first trimester of pregnancy. So I do not advise for pregnant women to stop cannabis abruptly because cessation of cannabis has also the side effects. It could be a withdrawal symptom. I advise them not to stop it abruptly, to advise a physician, but knowledgeable physician, how to do it. Usually everything fine. The relative risk to use cannabis much lower than to use cigarettes or alcohol for pregnant women. But we should inform our patients, women, how to do it and not to frighten them to stop the pregnancy because women want to be pregnant and want to be safer, and we should be sure that they will have safer pregnancy. Later. About THC toxicity. You know from the lecture of Professor Hanush, for each patient we should have this different cannabinoids. Sometimes it's not fit for anybody, for the same strain do not fit for many patients. So I should say that THC has its own toxicity. We should think about it. There is no harmless medication. However, we should inform our patients wisely to whom it should be used, when it should be used, when it should not be used. And we would like to increase our knowledge, our clinical experience in this field. Also, I already mentioned about tolerance and dependence. This is why people suppose that they would not have withdrawal effect. There is some withdrawal effect. I'm sure that we should not frighten our patients, but we should warn them that they could have some unpleasant feelings when they stop the using of cannabis abruptly. This is why we suppose that our patients who are traveling from country to country should have the right to bring with them their medication. It was just awful when I came to our conference last month, and we came with some patients from Israel, and they were not allowed to bring with them their medication. They felt very bad there. They represent on this conference Patients Association, and they had bad hours until we found them medication in Italy. It was very bad that our patients has no right to bring with them their medication. I suppose we should ensure the continuous treatment for such patients and not to force them because they have some withdrawal effect. I just brought you this example, how it's cruel to our patients not to be able to continue their medication. In Europe, within Schengen agreement, patients are allowed to travel from country to country with their medical cannabis prescribed by the doctors. It is protected by the government agreements, but it does not exist out of the Schengen zone. So I suppose this is a major problem. We should decide it with a short period in order to allow our patients to travel from Israel to Czech Republic, to Austria, to Germany, to countries that already possess cannabis for medical issues, for medical purposes. So I suppose we should worry about continuation of medical treatment for such patients. Also, highly debated effects is amotivational syndrome. I treated more than between 1,000 to 1,200 patients. I didn't see amotivational symptom, but this is my opinion. This amotivational symptoms is part of some psychotic disorder that could happen. Was wrongly related to cannabis, and we should work to reduce this demonization from cannabis. Also, it was supposed to be to have a gateway effect to open people to be drug abusers, and people who begin to work to use cannabis are going to use LSD and cocaine, different other narcotic drugs. We do not suppose that this is a real gateway effect because of the different kind of receptors are involving this. I already described you this cannabinoid system effect. Alcohol and cigarettes has much more gateway effects than cannabis in its form. Saying about marijuana, you know that now 8 countries in the world have official medical marijuana treatment program, and 24 US states already declared they have marijuana open for medical purposes in the states. However, the major obstacles for marijuana being prescribed for medical purposes is a position of the physician. You know, physicians suppose that the cannabis could be used, but they are not ready to prescribe it. They are not ready to use it for their clinical practice. It's the same data elsewhere in the world. The doctors are just brainwashed. For 4 generations of doctors are brainwashed, saying the cannabis is toxic, dangerous narcotic drug. So you could not expect from average physician to prescribe you cannabis. If you find someone, this is just a miracle. It's already established on the good standard. So as a level of evidence-based medicine, that cannabis has is analgesic, antiemetic, antispasmodic, and many other positive effects. So we should not discuss it's ever more. We just need to use it. we already gained the position we can use it for medical purposes and could persuade doctors that it is positive medication and not dangerous narcotic drug. But it was not done in my country and many other countries. We should educate doctors and train them in the proper way, saying what effects THC has for analgesia, and we should train them in order to change their attitudes from the largely negative to neutral or even positive. And I suppose that my duty is to be here to educate you in order you to educate your physicians. Your physicians should be educated and you should initiate it. Just be brave to initiate a dialogue with your physician. How to administer THC and cannabinoids? We suppose that inhalation is most effective way, vaporization is less harmful way. We need to improve the quality of vaporizers. Some smoking devices, simple smoking devices like electronic cigarettes are pretended to be vaporizers. You should distinguish between high quality vaporizer such as Volcano vaporizer, a stable one, a big device. This is just medical equipment, and distinguish them from smoking devices that are pretending to be vaporizers. You should distinguish between them. This is my duty to educate my patients and their relatives how to distinguish between two things in order not to waste their money for useful devices that not harmful but also has their own properties. We need to explain why there is a different marketing tricks in order to pretend some smoking devices to be vaporizers. We should distinguish them. We have criteria for vaporizers. There are many very good vaporizers in the market, but unfortunately we have many other devices that are pretended to be vaporizers, and they are not. They are providing the same quality of the smoke or with a tar content, and we suggesting you could not find the doctors that would advise you to use direct smoking or use smoking device in order to treat your lung problem or lung cancer or other sort of the cancers. We just would like them to use vaporizing as most efficient and less harmful way. Also other medications, Sativex is available in your country and in many other countries. But you know, Sativex is very efficient medication. The cost is tremendous. It is very expensive, just outrageously expensive, and we ask our government to put it in the primary insurance basket in order not to force our patients to pay it for too much. Unfortunately, it was not done in our country and in your countries also. This is why I advise Sativex only for people that would have insurance covering these expenses. For other patients, I advise to use cannabis oil for the same effect, with the same effect. And I would like to suggest other companies also to develop medications like Sativex with different CBD and THC ratio. We need to have much more medication, cannabis-based and natural products. Why we have only Sativex? I suppose that pharmacy should be much more active in this field. Pharmaceutical. So the empirical view. This is my final and conclusive slide. I suppose that we have a cannabis for medical purposes. We had a large way in order to study it, to know more about it. We could standing for legalization cannabis for medical purposes, like was done in Israel and in Austria, in Holland, in Czech Republic. So we have a good examples of a very good cannabis program. The best medical cannabis program is not in Israel, it's in Canada, where each physician is allowed to prescribe cannabis for these patients, and the Ministry of Health of Canada has no right to stop this recommendation. I would like this medical cannabis program will be progressed in each country, and this is a duty of us, doctors and patients, to develop in each country a special program that will be suitable for this particular country. And I hope that we will have a progress in this field. I invite you tomorrow to my next lecture, and would like to show you that we have a very, very good cannabis for medical purposes. We just need to learn more about it. Thank you very much for your attention.